Hello everyone, welcome to MBBS classes. I am Dr. Hanifa. Today in this video, I'll be talking on anatomy of posterior triangle. So I will cover on its detailed anatomy, contents and its boundaries. I hope you have gone through the class on anatomy of anterior triangle because the posterior triangle of the neck is complementary to the anterior triangle of the neck. Like its anterior counterpart, in the posterior triangle also you may encounter the diseases, any swellings or any other disease. So since it is an important topic for you all, I will try to make the learning of this posterior triangle easier for you all. In the end of this class, there will be a very simple test for you all. So watch the class till the end. Now let's begin. Can you remember the muscle that divides the neck into two triangles? Okay, you are very good. It's correct. It is the sternocleidomastoid, as you can see in this diagram. The sternocleidomastoid, it runs obliquely across the neck from the mastoid part to the sternum, and it divides the neck into anterior triangle and the posterior triangle. So our focus today will be only on the posterior triangle. Now let's see the surface landmarks of the posterior triangle. So if you see that the landmarks, if you palpate, it will be the mastoid process superiorly, which forms the apex of the triangle. Inferiorly, the base of the triangle is formed by the clavicle. Then anteriorly, the boundary is by the posterior border of the sternocleidomastoid, and the posterior boundary of the posterior triangle is formed by the anterior border of the trapezius. As you can see in this picture, this is a front view of the neck showing the different triangles of the neck. So if you see here, this is the sternocleidomastoid and the triangle anterior to it is the anterior triangle. And the anterior triangle, again, it has the four subdivisions or the four triangles. So if let us just revise it. These are the submental triangle, submandibular triangle, this is the carotid triangle, and the median one in the front is the muscular triangle. And the triangle which is posterior to the sternocleidomastoid and anterior to the trapezius, this is the trapezius muscle, is the posterior triangle. Now let's see the boundaries. So you know only anteriorly by the anterior boundary of the sternocleidomastoid, posteriorly by the anterior border of the trapezius muscle. The base of the triangle is by the superior aspect or of the middle part of the clavicle, and apex is at the level of the mastoid, where the two muscles, the sternocleidomastoid muscle and the trapezius muscle, they meet at the superior nuchal line. This posterior triangle of the neck is divided again into two subdivisions by the inferior belly of the omohyoid muscle. So this is the inferior belly of the omohyoid muscle, which divides it into the upper part, which is called as the occipital triangle, and the lower part, as you can see here, this is the supraclavicular triangle. It is called so because the occipital triangle, it contains occipital artery, and the supraclavicular triangle, sometimes it is also called as the subclavian triangle because it contains subclavian vessels. So just remember one thing, the posterior triangle has two subdivisions, whereas the anterior triangle has four subdivisions. So this is an axial section of the neck, with the figure is taken below the level of hyoid. So as you can see in this diagram, let us see the roof of the posterior triangle. As you can see here, the roof of the posterior triangle is formed by the investing layer of the deep cervical fascia. Here it is marked by the green colored, as you can see this one. So it extends, the roof of the posterior triangle extends from the posterior border of the sternocleidomastoid muscle. So this is the sternocleidomastoid muscle, and the extension is from here to the anterior part of the trapezius muscle. This is the trapezius muscle. So this is the roof of the posterior triangle. So in this diagram, again it is the same diagram where you can see the different fascias of the neck. So to go through the details of the anatomy on cervical fascia, you can go through our video on the anatomy of deep cervical fascia. So this is the green color is the investing layer of the deep cervical fascia. This is the pretracheal fascia, The carotid sheet is by the contribution of the three fascias, pretracheal, investing layer, and the yellow colored one is the prevertebral fascia. So the roof of the posterior triangle is formed by the investing layer of the deep cervical fascia. There are certain structures which lie superficial to the roof. These are the superficial fascia and the thin muscle, that is the platysma muscle. So there are certain structures which pierces the roof. So remember, it is mainly the nerves. These are the four cutaneous branches of the cervical plexus. So let us begin from superior. The first one is the lesser occipital nerve, that is the C2, C3. Then is the greater auricular nerve. The third one is the anterior cutaneous nerve. These three nerves are the C2 and C3 divisions of the cervical nerve. Then lastly is the supraclavicular nerve, again which has subdivisions like lateral, intermediate, and the medial supraclavicular nerve. Then another vein it pierces the roof of the posterior triangle is the external jugular vein, as you can see in this diagram. Now let us look into the floor of the posterior triangle. So the floor of the posterior triangle is mainly muscular and it is covered by the prevertebral layer of the deep cervical fascia. So as you can see in this diagram, the axial section of the neck, this is the floor of the posterior triangle. It is formed by the mainly the muscles which are in, or you can see the prevertebral muscles. These muscles are the scalene muscles, levator scapulae muscle, and the splenius capitis, and it is covered by this yellow colored fascia, that is the prevertebral fascia. Now let us see the orientations of the muscles which form the floor of the posterior triangle. Let's see their arrangement from the cranial to the caudal direction. So the muscles are semispinalis capitis muscle. This is the splenius capitis muscle. The next is the levator scapulae muscle, and the lowermost muscle is the splenius medius muscle. So these four muscles, they form the floor of the posterior triangle, and these muscles are covered by a layer of prevertebral fascia. So you have seen that the posterior triangle is divided into two triangles, occipital triangle and the supraclavicular triangle, by the inferior belly of omohyoid muscle. This is the inferior belly of omohyoid muscle. Now we'll be talking about the occipital triangle. So the occipital triangle, as you can see in this diagram, it is the superior and the larger part of the posterior triangle. It is limited inferiorly by the inferior belly of omohyoid muscle, and as you can see here, the muscles, the four muscles which forms the floor of the posterior triangle, they are the same muscles which forms the floor of the occipital muscle. Now let us see the certain structures which passes through, or which are the contents of this triangle. The most prominent nerve is the spinal accessory nerve. So as you can see here, this is the spinal accessory nerve. This nerve, this is the sternocleidomastoid. So this nerve, it pierces the sternocleidomastoid muscle. It crosses across the levator scapulae muscle obliquely. It passes backward and downward and reaches the deeper part of the anterior border of the trapezius muscle. Now there are other nerves also which are present in this occipital triangle. These are the cutaneous and the muscular branches of the cervical plexus, which emerge at the posterior border of the sternocleidomastoid, and the lastly is the supraclavicular nerve. As you can see, these are the supraclavicular nerve. This is the medial, intermediate, and the lateral supraclavicular nerve. Now let's see the contents of the occipital triangle. So it is called occipital triangle because it contains occipital artery. So this is the occipital artery, which is the most cranial content of the occipital triangle. The next content is the spinal accessory nerve, which runs from the sternocleidomastoid obliquely up to the trapezius muscle. Then we get the nodes around this spinal accessory nerve. Another content is the nerves like the supraclavicular nerve, the muscles which forms the floor of the posterior triangle. The other contents are the superficial transverse cervical artery and the four cutaneous branches of the cervical plexus, which passes from the posterior border of the sternocleidomastoid. The second triangle of the posterior triangle is the supraclavicular triangle. It is also called as the subclavian triangle. It is the lower and the smaller division of the posterior triangle, as you can see in this diagram. It is called supraclavicular because it corresponds with the supraclavicular fossa, and since it contains subclavian vessel, it is also all known as the subclavian triangle. Now let's see the contents of the supraclavicular triangle. So the content is the most important content is the third part of the subclavian artery. This third part of the subclavian artery, it curves. This is the third part of the subclavian artery. It curves inferolaterally from the lateral margin of the scalenus anterior muscle across the first rib to the axilla. The next content is the subclavian vein. This is the subclavian vein which is present behind the clavicle, and it may not be present usually in the neck, but it may rise as high as the arteries and may sometimes accompany behind the scalenus anterior muscle. Then the next component is the terminal branch of the external jugular vein. As you can see here, this is the terminal branch of the external jugular vein which descends behind the posterior border of the sternocleidomastoid to end in the subclavian vein. Then the other contents of the supraclavicular triangle are the trunk of the brachial plexus. The trunks of the brachial plexus, they may be easily palpated if the neck is contralaterally flexed in some of the cases and if the patient is thin. Then the other contents being the lymph nodes and the arteries. There are three arteries which are a part of this subclavian triangle: superficial cervical artery, superficial cervical artery, suprascapular artery, and the dorsal scapular artery. So in this class we have seen the boundaries, the contents, and the different subdivisions of the posterior triangle. So before we come to the end of our class, I have few pictures for you all. The diseases, there are certain clinical pictures. These are in 2 slides, and the diseased area is marked as the star mark, as you can see in these 2 slides. So what you have to do is you have to relate the locations of these swellings with the respective triangles. Just go through the individual pictures A, B, C, D, and E and just try to identify the involved triangles. You can post your answers in the comment section. With this, I come to an end of this video. Thank you for watching this video and thank you for watching MBBS classes.